Today, our guest is Stefan, and we'll be talking about artificial intelligence, data in Europe, and about Portugal. Don't go away.
O podcast Cruzamento tem o prazer de anunciar o lançamento de um curso inovador sobre a indústria farmacêutica. Numa parceria entre a Católica Medical School e a Luz Saúde, esta é uma oportunidade única de conhecer o end-to-end da indústria através de líderes de sucesso nesta área. Inscreva-se através da Católica Medical School.
Hello, and welcome to this episode of CRUZAMENTO Podcast. In today's show, we'll talk about the intersection of technology, healthcare, and sustainability. My name is André Correia, and together with me is my friend and co-host, Daniel Guedelha.
Hello and welcome to CRUZAMENTO Podcast. Stefan, it's a big pleasure to have you with us today. Maybe we go for the first usual question.
Cool.
In 30 seconds, who is Stefan?
Well, but 30 seconds maybe is a bit too short. But I'm so complex as a person. But I would say that I am an advocate for digital health and health data for all. My mission, the thing that really wakes me up in the morning, is digital health and health data for all in an equitable way. So that would be like really my life's mission. But I'm also a dad. I'm a friend. I'm a son. I'm all these things together, and I think that's what makes me, interesting as a person.
Thank you very much, Stefan. And let's just dive into some of these topics.
Yeah.
And in a time where we talk so much about intelligence
Yeah.
and artificial intelligence, let me start with that one. So, how can artificial intelligence revolutionize healthcare, and where do you see its limits when it comes to improving public health?
So we need to look not at just healthcare, but we need to look at health.
Mhm.
We need to look at the bigger picture. And yesterday I had the opportunity to give a keynote here at the Global Health Forum. And what I want to kind of propose forward is the idea that we need to sail into the age of AI.
Mhm.
And we need to look at solidarity. We need to look at action. We need to look at integrity. And at the end of the day, we also need to think about learning. So I think keeping these four things in mind is a very first step forward. So let's start with the first one. We're looking at solidarity. We need to think about an AI and data commons, because when you have AI commonly available and commonly understood, then you have a higher chance of getting that, to the bigger community, to think about equity. Then we have action. I love action because, action is about implementation and actually seeing something right in front of you. And I think we really need to focus on the boring problems first. There are many, many boring problems. Boring problems, like appointment scheduling.
Uh-huh.
It's not like a clinical, medical, it is something that needs to be resolved.
Uh-huh.
It's a pain in the ass.
Uh-huh.
That means that if someone comes late or someone cancels an appointment, it really bothers a lot of people.
Right.
So it might look boring, but it bothers a lot of people. So if we start tackling this, then we can really take big steps forward. And then we have the idea of integrity. Integrity is when you make sure that you don't just throw any AI into production and don't have a look at it. You just let it go. No, you have like an evaluation process. You set up a contract where you continuously develop this AI, not just let it there. You have a maintenance and support agreement. So you prepare everything for this AI to take like the longer, bigger picture. Because when you take care of an AI, and that's where I go into the next one about curation, when you take care of it, you have a better chance of gaining trust. They say, oh, AI is really useful. Okay, so, and it's being maintained and people take care of the feedback that I send. So, this. And last but not least is learn. We need to focus on curating our knowledge sets. We're curating our data sets. And why am I saying this? Because when you curate your data, when you take care of it like it's your baby, the data, then you have a much better chance of having really high quality AI. We all know about like crappy data, crappy AI. So having this, really curating it, and even better, now we're seeing a future where large language models are very resource intensive in general. So we really need to set up systems where there is a combination of knowledge graphs, which are very much less resource intensive. You just have a text file or on computer, on your own device, and you build on that. And then you have the power of large language models, which take this knowledge graphs, take this, bring it together into something that someone can understand. In fact, when people ask me about large language models, I tell them that it's like a T9, but of whole paragraphs. And sometimes T9 can mess up a bit, but combined with your knowledge graph, whoa, the possibilities are truly, truly amazing there.
And creating some impact on those boring problems.
Yes, exactly. I think we really need to start looking at that, because once you have those small victories, then people will trust you for the bigger victories.
Yeah. Potentially more impactful.
Yeah, exactly. It would be like directly relating to healthcare and public health outcomes, bringing together the whole picture of health, not just the hospital-based care, but also public health. We need to really keep those things in mind.
And one thing that I really like, Stefan, you talk about equity.
Yes.
You were talking a lot about curating the data.
Yeah.
Which maybe brings me, was just constructing the next question.
Okay, cool.
In the context of AI-driven healthcare, what is preventing medical data to be easily accessible, so the equity, and shareable across European countries? And what steps should be taken in order to cross this barrier?
I mean, now we're running against time, and I think the European health data space will have a big role in this.
Okay.
So this is the upcoming regulation. And even like when I was part of the COVID-19 response team in Malta, regulation played a very, very big role for data quality. So I really see a big role for the European health data space. I mean, it's not a perfect regulation, but we really need to work on it to get it out there. And I think the way we need to look at the European health data space regulation is that it has an iterative approach. That means that, of course, we'll try to implement the very best version of it, but we need to get member states to think iteratively. That means that sometimes when you implement regulation and then you come to implementing it, there's like some things start happening. You start seeing some holes that need to be fixed. And I think with the same, we have to have this approach that we iteratively build. Now, let's go a bit back to basics. I think one of the biggest challenges that we're facing that at times there is simply no data. Medical records are still happening on paper. We have countries, even big countries, struggling with this. So this is not just a low-income country, but a high-income country who still has medical records on paper. So we're still kind of tackling these problems first,
The basics.
We're the basics. So we can't have AI without digitalized data, to start off with. So we really need to start solving those problems at first. And that's why we talk a lot about AI. And it's true, I love AI and I think of it as a huge, great potential. That's why I love generative AI, because it can help bridge this gap that there is between the paper-based world and the digital world. Like, because people say, I'm writing something, and all of a sudden you have this link. It makes it much easier. I mean, if you just use generative AI, for example, even to create something like metadata records, you ask for like, listen, how can I develop a data catalog? All of a sudden you have like this bridge happening. Or like, listen, how can I get started with electronic medical records? You start, you get, you can implement this and this. I actually, for example, last time wanted to set up an open MRS server. It actually gave me some instructions on how to do it on Docker, for example. And then maybe I had to fine tune the process again, but it actually got me started, like a mental icebreaker of sorts. I really love that.
It gives good pointers to where to go there.
Yeah,
go
like
there
what's the next
in
step?
the next step, exactly. So you've talked about data, patient records, how to bring that into the digital world. That kind of leads us to the ethical question. So what ethical considerations should be at the forefront when implementing AI in public health or global health in general? And how can we strive a balance between technology advancements and then the patient privacy?
Okay. So I think we need to design systems with a couple of things in mind. We need to make sure that they're sustainable by design. So we need to start seeing their environmental impact. We need to think of privacy by design. That means that when we design a system or even legislation surrounding it, we think very strongly about the idea of privacy. That means that we have to give the choice that the patient, if they don't want to share with a particular person, for example, they have that option. But we can't leave out, for example, specific situations where public head might need access to a subset of information to tackle a public head challenge. So we really need to keep everything in mind. But I think it's all about as well the user experience. That means that it's extremely easy to manage your privacy. Extremely easy. You go, you have, for example, an audit trail of who accessed your records, easily accessible. If you want to receive an email notification, you receive it. If not, okay, but it's your choice. But you give them the choice. So the user experience needs to be upfront and center, a priority. I think there is the big opportunity that once we start looking into this, once we start looking into the user experience of privacy in general, that it's easy for me to figure out, okay, I know that these are the terms of conditions of my app. They're easy. It's not like legalese, 30 pages of legalese.
That's always the issue, right? Because then it's too big. How can they?
I have a colleague. I'm lucky enough to have a colleague who is in the same research group as I am, ECRA in Germany. And she's actually working on the privacy and the terms and conditions. She wants to improve this user experience. And she's a lawyer by training. So it's really cool to kind of see that we need to even think about the user experience of AI at some point, and sooner rather than later. That means that if you decide to use a specific AI's supported system, because I don't like to say just AI, this is powered by AI. No. It's really powered by AI techniques. That's the term we need to kind of really think of. That the user experience needs to be seamless there as well. And that's how we bring equity back into the equation. Because for example, an 85-year-old who decides to use this system, there might be a need of an intermediary. It could be a relative, it could be a nurse, for example, who's focused on, digital health and AI, who knows how to bridge this barrier. It could be, for example, that this lady, she lives in a particular town. She lives 2 minutes away from the local health center. She says, listen, I'd love to use this AI, but I struggle with technology. Let me go talk to this digital health nurse or this digital health doctor. And this person helps this lady to start their journey. And like this, you get the best of both worlds, because you get the patient onboarded onto the AI or digital health system, and you get the doctor benefiting on improving healthcare outcomes or public health outcomes, let's say, for this population or for that individual. So you have this needs to be upfront and center, the user experience. How am I going to prove that?
Here, Stefan, I was just reflecting here out loud, because it's kind of a digital health Spock, single point of contact in a community. Okay. And maybe that person doesn't need to be part of a healthcare system. Maybe it could be like a regular person that knows about digital kind of tools for those basics. And then we could potentially spread a little bit more the digital use of those tools. And you alluded to Malta. You talk about Malta.
Yeah.
And are there any specific healthcare projects unique to Malta where AI has helped looking at healthcare practices, sustainability, and innovation? Are there things you wanted to share with our audience?
Yeah, so if you have a look at our AI strategy, which is actually, it's already kind of up for a second review, actually. So a review, actually. So it's already being kind of looked into, because it's evolving so quickly. And yes, there are healthcare projects. There are 3 of them. I can't remember all of them, I'll be honest with you. But one of them, the focus is on personalization. But this is a constant work in progress. And even the things are evolving so quickly, in Malta, that we constantly reevaluate and relook in. So, but there's a lot of things happening in Malta, and I think Malta is leading when it comes to AI legislation, and also when it comes to setting up, for example, the Malta Digital Innovation Authority, where they're setting up the regulatory sandboxes. So there's some things happening, and even this in parallel with the work which is being done on the AI Act as well. Now, the biggest change that I'm seeing, when it comes to this AI legislation, is that maybe we need to look at not specifically legislating the technology, but rather the values behind it, like legislating bias.
Okay.
For example, to ensure that not only AI, but any technology, that is put out there, keeps in upfront and center, bias as part of it, that they need to be mitigate for it. So I think this is something that I'm seeing evolving, and I'm constantly kind of getting closer to these ideas.
Okay.
And you've mentioned we've covered the different topics, and I just get the feeling that we are also constantly talking about sustainability.
Oh, yeah.
So if I think about the ESG, the environment, then we have the social, the doctor, the practices, the governance around, which is also part of sustainability. This is a growing concern globally. And how can AI contribute to more sustainable healthcare practices? And what innovations have you seen going out there?
It's quite a challenging question, because maybe it might require do a couple of literature searches. But I think if you had to look, let's kick off with the most trendy technology that there is in AI right now, which is generative AI. Even just having the opportunity to ask about it, like ask, for example, what is the environmental impact on digital health? Just asking it to a generative AI model, and start getting this mental icebreakers, start getting some answers, even just starting from that. There's already potential for people to start thinking about the topic. Okay. Of course, the next big question is like that you need to be careful, because even like you need to learn how to use a generative AI tool. But now, for example, with the evolution that I've seen, for example, in art. So for example, you have Midjourney, and then you have DALL-E 2, which is now becoming DALL-E 3. And now the biggest competitive edge that DALL-E 3 will have on Midjourney is that Midjourney is more parameter based, where you actually have to write keywords, tick, 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 and you stick to those parameters and instructions. DALL-E 3 will be more prosaic, more, like more, sentence based, something which you can write. Like, for example, please set up a photo of 20 Portuguese looking people in Cascais. Now, of course, this can be quite controversial, but most probably DALL-E 3 will give you a closer answer, rather than going on Midjourney and writing Portuguese, people, Cascais, 4K, cinematic, HDR.
With the context.
The sentence is much different. And I think that's we also need to be slightly careful here. In fact, if you see one of the talks by Yuval Noah Harari on how AI is like hacking the operating system of humans, which is very, very interesting, because the operating system of humans is language. Languages have created religions. Languages have created whole cultures. Like, think about it, like Portuguese culture is based on Portuguese. Like, even the way you speak, I when I was here, like, I was like, there's this passion, and I think we really need to be on top of it. We need to be on top. We need to make sure that we need to have a really close look at the models behind the generative AI. We can't just let them happen. We have to really keep a close eye on them. We have to be diligent, and I'm sure that Portugal would be really excellent on this, because you guys keep each other in check so well. Like, I truly love it. I was like,
it's a compliment.
Yeah, many people see it as a criticism, but I see it as a strength.
I think it's a strength.
It's a strength.
It's a strength.
And no wonder that you guys have e-prescriptions for the whole country. No wonder you guys are like leading in terminology. No wonder, because you guys are constantly kind of pushing each other, which is really great. And I really hope for you to be, Portugal especially, to be excellent in AI. I really have high hopes for you guys.
Thank you very much, Stefan. I think it's a very, very good. We are just ending our conversation and our episode today. And indeed, keeping each other's a check, and in a constructive way as well.
Yeah, exactly.
There is this positiveness that is always needed and necessary.
Yeah, I agree.
And Stefan, so we want to thank you very much for being
You're
with
welcome.
us today.
Obrigado.
Obrigado. It was very good. And today we discuss about different topics, the importance of equity, is a
Mhm.
word that we use a lot, curating data, something that was as well a very important element, all the ethical implications of the use of AI, machine learning, and innovation. We also discuss a lot about innovation. Stefan, last but not least question, if our audience wants to find you online,
Yeah.
where is the best way to do it?
Just write my name, Stefan Buttigieg. Of course, it's a bit complex to write my name. We all had a bit of a laugh about it in the past few days. But if you can find me on LinkedIn, LinkedIn is my place to be. I love to be on LinkedIn. I have a website, stefanbuttigieg.com, but LinkedIn really is the best place to connect with me. I would like to do a small note about CRUZAMENTO.
Please.
So I got to learn in this podcast that CRUZAMENTO means intersection. And I remember that in my very first definition of digital health, when I was teaching my students, I just said that digital health is the intersection of technology with healthcare. Since then, the definition has actually evolved quite a lot. And now I'm looking at digital health as being a cultural transformation. So I think the beauty of it is that CRUZAMENTO can become, the cultural transformation of healthcare and public health. So by doing this cruzamento, this intersection, we're creating a culture transformation. And really want to thank you guys for your work today.
Stefan, thank you very much. It was a great pleasure talking to you and learning from you. And for those that are listening and hearing us, if you like this episode, this conversation, just push the subscription button. Follow us on the social networks. You can also find us on different podcast applications of your choice. So that's all for now. Thank you very much. Stefan, again, thank you very much.
Yeah, I'm listening to you on Spotify, guys.
Thank you.
See you there.
Cheers.
Cheers.